lecture on hemolytic disease of the newborn, also known as Erythroblastosis foetalis, brought to you by GSC EXCELLENCE ACADEMY. Before you continue, please always consider subscribing to the channel and sharing to your friends. Okay? Now, what is hemolytic disease of the newborn, or what we call Erythroblastosis foetalis, or what we call a Rhesus disease? How does it come about? It comes about as a result of what we call the Rhesus Factor, okay, which is a type of blood group which was discovered in monkeys. But this blood group also happens to be in humans. Now, most of the time when you go to the hospital, if you have ever been tested, if your blood group has ever been tested, you see that they will tell you you are A positive, okay? When they say you are A positive, what they mean is you are A, blood group A, Rhesus positive, meaning that you have the Rhesus antigen. Just like they can tell you that you are AB positive, they tell you that you have the Rhesus antigen. Now, when they tell you that you are maybe B negative, okay, it means that you don't have the Rhesus antigen, right? So that's just the simple stuff about the Rhesus. But now, how does hemolytic disease of the newborn come about? Hemolytic means breakdown, okay? Meaning that there is breakdown of something. Here there is going to be a breakdown of red blood cells, okay? So now, we have a problem when the mother or a woman is a Rhesus negative woman gets married, okay, to a father or to a man that is Rhesus positive. Okay, that's where the problem comes. That's the only place where the problem comes. So if the woman is Rhesus positive and the husband is Rhesus positive, no problem. If the man is Rhesus negative and the woman is Rhesus positive, no problem. The only problem comes when the mother or the woman is Rhesus negative and the husband is Rhesus positive. Okay, so you have Rhesus negative, Rhesus positive. Why is it a problem? Because when these two maybe during sexual intercourse, okay, the sperm is going in order to fertilize the ovule, okay, or the ovum. It's going to result in a Rhesus positive baby. Okay, the fetus is going to be Rhesus positive, right? Now, for the first pregnancy, there is actually no problem. Okay. Now, the problem comes because during birth, you're going to have the Rhesus positive blood of the fetus is going to cross, okay, through when during the process of clamping of the umbilical cord, it's going to cross into the maternal circulation, okay. So that's when the first baby has no problem. So there is mixing of the baby's blood and the maternal blood during the process of clamping the umbilical cord, okay. And now what is going to happen is that the mother's immune system is going to react, okay, and is going to produce immunoglobulins, that's antibodies against the fetal red blood cells. Now remember that under immunology, we talk about the adaptive immune system, okay? We'll talk about the innate and the adaptive immune systems. The innate immune system means everybody has it. The adaptive immune system is what gives us a specific immune response against a particular antigen. So here we have the Rhesus antigen which has been introduced into the maternal blood, which is now seeming to be what? It is seeming to be something foreign because the maternal blood is not Rhesus positive. So it's foreign to the maternal immune system. So the immune system is going to be stimulated to produce antibodies against the fetal red blood cells. And of course, this is the adaptive immune system, so it's going to keep the memory of this Rhesus positive red blood cells, okay? So there is a memory about it that is going to be stored in the maternal immune system. Now, for the second pregnancy, okay, when the next pregnancy, the subsequent pregnancy, okay, when the baby is born, because we're still going to have a Rhesus positive fetus. Now, the anti-Rhesus antibodies, okay, just know that the anti-Rhesus antibodies are actually IgG, okay? They are actually IgG, immunoglobulin gamma, and this immunoglobulin gamma have the tendency to cross the placenta and get into the fetal circulation. So immunoglobulin gamma is the only immunoglobulin that crosses the placenta. Okay, so you see that during the next pregnancy, this immunoglobulin that were produced against the rhesus positive red blood cells of the fetus is going to cross the placenta, get into the fetal circulation, and then it's going to destroy its red blood cells. And now when it destroys the red blood cells, when it's breaking down the red blood cells, it is what? Hemolytic. Okay, it's going to cause a lot of problems, for the, and the child can even die in utero. Okay, and how do you prevent this? So that process of breaking down that red blood cells by this immunoglobulin is going to cause what we call the hemolytic disease of the newborn, or what we call erythroblastosis fetalis. Erythroblastosis fetalis. Okay. Alright. Now, how do you prevent this from happening? During maybe the antenatal visits by the mother, if the mother is discovered, is screened, and she's shown to be rhesus negative, then the father is also going to be screened. And if the father is screened and is rhesus positive, then during birth, during the first, of course, if it's the first pregnancy, during birth, there is an immunoglobulin that is going to be given that we call it program. Okay, program. Rogam is actually an artificial form of the anti-rhesus antibodies, which is going to be, we call it the anti-D. Okay, he has what we call the D antigen. So it's going to have the anti-D antibodies. So it is going to destroy the fetal red blood cells that are going to get into the maternal circulation to prevent the maternal immune system from recognizing these positive red blood cells from the fetus. And so the maternal immune system is not going to record any information about rhesus positive red blood cells, and so the next baby is going to be saved. Okay, so you can just comment if this video was helpful for you to understand what is known as erythroblastosis fetalis. See you for more in the subsequent lectures for more videos. Okay.